Hey everyone! In today's very comprehensive video, I'm going to thoroughly cover all of the most common signs and symptoms associated with urinary tract infections. UTIs are extremely prevalent, affecting up to 60% of women and responsible for around 8 million doctor visits annually in the United States. Recognizing the wide range of potential indicators of UTI is crucial for prompt antibiotic treatment and preventing complications. I'll be explaining what exactly causes UTIs, which parts of the urinary tract are involved, populations most at risk, differences between lower and upper UTIs, and extensively detailing the many symptoms both localized and systemic that can signal a potential urinary tract infection. There's a lot of helpful info here, so make sure to stick around until the end to get the full overview of UTI symptoms and how to discern if you may be suffering from one. Alright, let's get started. What are urinary tract infections? First, a UTI refers to an infection caused by microorganisms, usually bacteria, that affects any portion of the urinary tract system. This includes the urethra, bladder, ureters that carry urine from the kidneys, and the kidneys themselves. While fungal UTIs occasionally occur, the vast majority are caused by pathogenic bacterial strains, especially E. coli from gastrointestinal contamination. The urinary tract was previously thought sterile, but we now know organisms colonize these areas. The most common type of UTI is cystitis, which is a bacterial infection specifically targeting the bladder. However, UTIs can ascend up the ureters and infect one or both kidneys, known as pyelonephritis, which is far more serious. Some people have asymptomatic bacteriuria, meaning bacteria colonizes their urinary tract without invading the tissues or eliciting symptoms of true infection. However, others experience full-blown symptomatic UTI. Who gets UTIs? Women are much more prone to UTIs, with 40–60% developing at least one over their lifetime. This relates to female anatomy. The shorter female urethra allows pathogens quick access to the bladder. The urethra's proximity to the rectum also facilitates contamination. UTIs most commonly occur in sexually active women ages 16–35, though they can happen at any age. Risk factors that increase UTI susceptibility include sexual intercourse, diabetes, urinary tract abnormalities, catheter use, and a prior history of UTIs. Now let's explore the wide range of symptoms and signs that can indicate a urinary tract infection. We'll start with the most common localized symptoms of cystitis. Classic symptoms of cystitis lower UTI is dysuria. Dysuria refers to painful, burning sensation when urinating. This results from inflammation of the urethra and/or bladder from the infection. Dysuria is one of the most characteristic UTI symptoms. Urinary urgency. Urgency refers to a sudden, intense urge to urinate, like you might not make it to the bathroom in time. It develops from bladder irritation and increased pressure. Increased urinary frequency. Frequency means needing to urinate more often than usual, despite not drinking excess fluids. This links with urgency, as the inflammatory state of the bladder prompts frequent signals to void even when urine volume is low. Hematuria. Hematuria means blood present in the urine, usually microscopic without visible red discoloration. Some minor urothelial bleeding can occur from infection and inflammation damaging the urinary tract lining. Cloudy, foul-smelling urine. Bacteria as well as pus from white blood cells fighting the infection alter urine's normal clarity and odor, making it appear cloudy with an foul or strong scent. Suprapubic pain. There may be aching pain or discomfort felt over the bladder region, known as suprapubic pain. This reflects cystitis and bladder irritation. Urinary hesitancy. Hesitancy refers to difficulty initiating urination and/or maintaining a steady stream, which may come and go. Some post-void residual dribbling or a feeling of incomplete bladder emptying may occur as well. Those are the most common localized symptoms of a lower UTI like cystitis confined to the urethra and bladder. Next, let's go over potential systemic symptoms of an upper UTI. Symptoms of pyelonephritis upper UTI is: if cystitis remains untreated and the infection ascends to the kidneys, more serious sequelae can manifest. Flank pain. Pain in one side of the back below the ribs reflects one kidney's involvement. This pain may be acute and severe, especially when pushing on the area. Fever and chills. A kidney infection often elicits immune responses like fever and chills as the body combats the invading pathogens. Nausea and vomiting. Nausea and vomiting results from the systemic illness caused by the kidney infection. Vomiting may make oral antibiotics difficult. Other symptoms: Extreme UTI cases that turn into urosepsis, though rare, cause additional symptoms like low blood pressure, rapid heart rate and breathing, and mental confusion from sepsis. In summary, lower UTI symptoms primarily involve painful, urgent, frequent urination with some localized discomfort. Upper UTIs affecting the kidneys cause systemic upset like fevers, chills and nausea on top of bladder irritation. Prompt medical treatment is key, as serious kidney injury can result if pyelonephritis is neglected and spreads to the bloodstream. Let me know if you have any other UTI-related questions. Thanks for watching.